If you look at page 8, all enteral feedings are basic care and comfort. And so that's this one. In other words, your doctor ain't managing this shit. You are. You are. You're managing all of the tube feedings, not the doctor. That's why it's basic care and comfort. Now, you guys blow this, so let's know this. If you look at the nasogastric tube, remember a couple of things. There are several reasons for an NG tube. Some may truly be that you are using it for feeding, but don't forget it's called on your test for other purposes. Watch this. Gastric decompression. This means you are in the hospital for some type of GI problem, and the last thing we need to do is feed you. In fact, we need to keep your tummy from being distended. Does that make sense? This is very often the bowel obstruction or the pancreatitis patient who needs to have their gastric area decompress, which just means take the air out. That is very often a Salem sump tube. I'm going to just put that here. Salem sump. So when we tell you to take report in a room, follow all your lines, including this line, which is a tube. Follow it and see where it is going to, what's happening, you know, where are we going with this shit? Okay. Now, there's a couple things that have changed dramatically in NG tube feeding. So you're going to go with your girl. Do you see where it says under enteral feedings, it says to prevent aspiration, check your placement, aspirate gastric contents. That's gospel. That's all over your test. But above it, it says intolerance. A little bit above it, it says intolerance can develop. That is going to equate to a high residual. Do you see that? Here's what you need to know. The residual has changed. When I was a nurse, way back when Caesar was a little boy and Moby Dick was a guppy, back in those days when I first got out of school, anything over 100 was considered a lot. Then, 10 years ago, anything over 200 is considered a lot. What is it now? It's 500. Write it. So if the residual is 500 or more, that's when you're gonna call. And you damn sure ain't pushing it back in. Remember, we absolutely do not routinely check residual. Not anymore. We do not routinely check residual. What we do instead, so if you go up to bullet point number 5, where it says flush with 60 cc's sterile water, never tap, every 4 to 6 hours before and after feeds, and then it says medication administration and after residual. We're not routinely checking the residual, but when you do have to flush. Okay, so we don't check residual routinely anymore. Make sure you know that. Lots of things change. Okay, babies. Now, what I want you to remember at the bottom, it says medication administration through enteral NG tube. Many of your patients are going to have what's called a Corpak. Raise your hand if you've seen a Corpak. Well, I should say it like this. Raise your hand if you've never seen a Corpak, because there's plenty of people that have never seen a Corpak. A Corpak is about 1/2 the diameter of an NG tube. It's yellow, it's very skinny, they clog very easily. So you don't want to fuck this up. And I know you're gonna work with people that say, oh, just throw them all in there. Shit, not me. I ain't trying to clog no damn Corpak. That shit is hard, okay? And Corpaks are not fun to put in the patient because they have the bridle and it's a piece of shit to deal with the patient. Remember like this, the most offensive, uncomfortable, painful procedure in this whole pack is inserting an NG tube. That's the most offensive one of all, okay? So you're not trying to fuck up their damn Corpak. So look at what I put. Medication administration through the enteral NG tube is the #1 cause of occlusion because so many of your medications are liquefied and they turn to freaking sugary syrup that clogs the tube. It's nasty. And you are not flushing it the way you should. And you gotta flush like you're losing your mind with all these meds. You gotta flush, 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 flush. If I have a syrup that has been ordered, like my perfect example for you is Tylenol. Liquefied Tylenol is a syrup. Oh my God, I'm gonna dilute the shit out of that. That ain't going down by itself. I'm going to dilute the shit out of that because that's gonna stick and cause everything else to stick. And then it's gonna occlude within your shift. Okay, so it's not gonna take long for you to find out you fucked up. Now, so you see here, liquids are preferred, but must be diluted, highlighted. Bulletproof number two, bullet point number 2. Remember not to push alphabet soup through your tube. What does that mean? That means any medication with letters after it. Wellbutrin, SR. Okay, something, something, XL. Something, something, CR. Controlled release, extend release. None of that shit. If it's got ABCs after the name, you ain't pushing that through no NG. Okay, so that's another tip. So you see it says alphabet soup under bullet point number 4. See handout, no enteric coated, sustained release, sublingual, buccal, or alphabet soup. They will become toxic. They absolutely will become toxic. Okay, they were meant to dissolve very slowly and not in the stomach. They were for the small intestine. Okay, never, did I say never? I'm sorry, never again. How about never one more time? Okay, just one more time. Never crush potassium. You got a lot of people that did and do. They are assholes. Did I say never? I don't know if I said it enough though. Never again. Okay, turn the page. If you look at the next page, this one is your gastric decompression tube. This one, I want you to highlight the whole damn sentence because many nurses forget that an NG tube is not just for feeding. It's for gastric decompression. They like to ask you questions about gastric decompression. Let's start our education. What chemical is in the stomach? What is it called? Where are my nurses? Hydrochloric acid, right? You talking about acid like it's on a battery. Acid up in there, shell bell. Okay, so hydrochloric acid. That means, beloved, if you have this tube, you're removing a hell of a lot of hydrochloric acid, leaving your patient to become metabolic alkalosis. I bet you better know that shit. That is the last bullet point. I cover your ass with everything I say in class. It's always in writing somewhere, and it's right there. Okay, so right